This week's Ask Dr. Durie comes from a patient who has learned that the IMF is developing a virtual tissue or biobank and wants to know, what is a virtual biobank? The IMF, through its research division, the International Myeloma Working Group, is indeed developing a virtual biobank. What this means is that tissue samples like bone marrow samples and blood samples are collected from patients who are undergoing treatments, particularly the newer immune therapy treatments, so that we can understand the mechanisms of why one patient might respond and another patient might not. For example, if an anti-BCMA therapy is being given, maybe a patient might have a low BCMA level on the myeloma cells, and this could explain the lack of response. So by using a biobank, this type of thing can be tested. The concept of the virtual biobank is one in which all of the samples are tested at the local center. So at the local university hospital or referral center, samples are collected there and tested. And then, rather than sending all of the samples to a single central laboratory for testing, which is quite cumbersome, the results are sent to a central computer for storage and analysis. And so samples are kept in the local setting at the local center, and the results are entered into a computer and submitted electronically for storage and analysis. This is much more efficient and is very attractive to investigators who have control of their own samples and are able to conduct the testing which is of greatest interest for their own patient population. So we are very pleased that this is a new initiative for the International Myeloma Working Group. Dr. Weiju Chung, IMWG member at the University in Singapore, has in fact already started this virtual biobank process for the centers that we work with in Asia as part of the Asia Myeloma Network. And so we have gained some experience about this virtual biobank process. And now, through the broader IMWG community, we are planning to initiate the biobanking process on a global basis so that there can be tissues tested around the world in different trials and data collected for central analysis. And this is something that will be very important. And so, bottom line, a virtual biobank is really an important new concept, but will actually transform and enhance our ability to do what's called correlative research, where samples will be correlated with the status of the patient, the toxicities that might be experienced, and the eventual outcome. And so this is a very, very powerful new research methodology.